thank you all very much for joining us for tonight's webinar. Let me make sure the system is up and running, and it looks like you are. This is a reminder that we are going to record tonight's program and make it available for replay. Currently on your screen, you should be looking at the DCMA homepage. And that is a location where we've placed a lot of the background materials for tonight's program as well. And those are resources there for you as well as your patients as you prepare for the start of hurricane season. So tonight's focus of our programming is to provide some tools and resources for DCMA members to be prepared for the start of hurricane season, which is June 1st. We're extremely pleased to have a number of our physician members on board with us who are going to go over a PowerPoint presentation with some materials and helpful information for physicians and some tips on how you can engage patients in making sure that your patients are prepared for hurricane season as well. I'm going to start with some introductions of tonight's speakers, and then at that time I'll go ahead and turn over the program for our planned comments. So first we have Lauren Shapiro, who is an assistant professor of clinicals at the Department of Physical Medicine and Rehabilitation at University of Miami Miller School of Medicine. After earning her medical degree from SUNY Stony Brook, she completed her PM&R residency at the Northwestern University program at the Rehabilitation Institute of Chicago, where she served as chief resident. She subsequently earned a master's in public health degree from the Bloomberg School of Public Health at Johns Hopkins University. In 2014, she was among the first physicians to earn subspecialty board certification in brain injury medicine. She currently provides inpatient rehabilitation care for survivors of traumatic brain injury, stroke, and polytrauma at Jackson Memorial Hospital, where she also provides clinical and didactic education for medical students and residents. Her clinical and research interests include the optimization of rehabilitation for and prevention of secondary injuries among adults with neurological conditions. Additional areas of clinical expertise include the care of individuals with limb loss, residual impairments from polio infection, and concussion. Our second speaker tonight is Jair Munoz Mendoza. Jair is currently Associate Professor of Medicine at the University of Miami Katz Family Division of Nephrology and Hypertension in Miami. He is fellowship trained in nephrology from Stanford University in California. He conducted his residency in internal medicine at the Albert Einstein Medical Center in Philadelphia and attended medical school in Lima, Peru. And then our third speaker tonight is Carlos Ramirez-Mejia, who is a neurologist and partner at First Choice Neurology at Medical Arts Neurology in Miami. He is board certified by the American Board of Psychiatry and Neurology. He's also fellowship trained and board certified in sleep medicine. He did his medical training at Caldas University in Columbia. He did his internal medicine internship at George Washington University in Washington, D.C., and his neurology residency training at Georgetown University, also in Washington, D.C. So we're extremely pleased to have our three speakers tonight. They are all participating in the DCMA Physician Leadership Academy program as well, and part of their Leadership Academy program was to present this information as a project to help prepare DCMA physicians and your patients for the storm season coming up. So with that, I will turn over the program to Dr. Shapiro. Let me pull up your slides here. And Dr. Shapiro, let me make sure this is going to run. And Dr. Shapiro, you can go ahead and start with your comment.
All right, thank you. So tonight we'll be talking about how you can better prepare your patients for disaster. We're going to be focusing on emergency preparedness for people with disabilities and special needs. Next. We'll skip this slide. While the focus of tonight's talk will be on better preparing our patients, I'd like to take a moment just to remind everyone that the Atlantic hurricane season is just around the corner, starting June 1st and running through November 30th, with a peak in our area in September. Just as it's important for us to prepare our patients, it's also important that we prepare ourselves, our family, and even our pets. Miami-Dade County has a wonderful hurricane preparedness guide. Just for general information, the link you can find here. It's also a great time to evaluate your clinical coverage plans and policies for hurricane season. It's important that we're all prepared to help provide care in the aftermath of any storm. People may suffer injuries, they may have illnesses, which are often heat-related, and they may require our attention. We may also be called upon to help replace medical equipment, medications, and supplies. But for tonight's talk, we're going to focus really on preparedness for emergencies for individuals with disabilities, as well as those who may have special medical needs. It's important that everyone appreciates the importance of preparedness for these patient populations. Additional objectives will be to list essential components of an emergency supply kit, to discuss means of and considerations for evacuation, to recognize the special needs of people with medical needs during and after disasters, including those who require dialysis, and lastly, to understand how physicians can best help their patients prepare for disaster. It's very important to recognize that individuals with disabilities are particularly vulnerable when disaster strikes. Studies have shown that they're less likely to evacuate in the event of an emergency, and they're at increased risk of injury and death, as well as even have a higher incidence of property damage. And just overall, these patients have greater difficulty getting their needs met, and this can result in emotional, physical, and financial stresses. Unfortunately, we've seen that there have been very serious flaws in emergency management and disaster response for individuals with disabilities, and this has been especially evident following recent major hurricanes. Many hurricane-related deaths are due to barriers to access to care following a storm. Studies, though, show that Americans with disabilities are actually less likely than others to be prepared for emergencies. And one of the reasons we're having this talk this evening is because we believe that as physicians, we are well positioned to help educate and prepare our patients for disaster. I wanted to take a brief historical look back at the aftermath of the recent hurricanes, starting with Hurricane Katrina, which of course hit the Gulf region in August of 2005. With this storm, the deaths disproportionately occurred among those ages 60 and over. This population comprised 73% of hurricane-related deaths in New Orleans, even though they comprised only 15% of the population at that time. And the high prevalence of disability in this age group is thought to be the primary reason why this occurred. Following Hurricanes Katrina and Rita, the National Council on Disability issued a report highlighting where some of the problems occurred. They found that most of the evacuation buses didn't have wheelchair lifts. They found that individuals with vision and or hearing impairments were unable to obtain safety information. They also found that there was abandonment of nursing home patients, which accounted for at least 68 deaths. Some American Red Cross shelters outright refused to care for disabled patients, and there were long-term housing issues in the aftermath. A short time after, Hurricane Rita also hit the Louisiana and Texas border in September of that year. Prior to Hurricane Rita, there were massive evacuations in New Orleans as well as Houston, and unfortunately, over 100 people died in accidents or from health problems related to their evacuation. And this included 23 nursing home residents that were killed in a bus fire. There was also a considerable rise in hospital admissions during this time due to evacuation-related illnesses, things like heat exhaustion, heat strokes, and deep vein thromboses. Moreover, the storms and evacuation displaced thousands of Texas children who had disabilities who were in need of intervention services and special education. Additionally, the FEMA trailers that were initially used during and after Hurricane Rita were not wheelchair accessible, which led to some long-term housing issues for people who were displaced. Superstorm Sandy struck the East Coast in October 2012. There was significant flooding and power outages, primarily in New York and New Jersey. Again, there was a lack of accessible transportation, which hindered evacuation attempts. There was also a lot of difficulty evacuating people who were trapped in high-rise buildings, sometimes for days, unable to exit. Furthermore, there was a loss of accessible homes and home features, as well as durable medical equipment. There were some legal implications following Superstorm Sandy, and that a judge ruled that New York City violated the Americans with Disability Act by failing to provide people with disabilities meaningful access to its emergency preparedness program. Unfortunately, things didn't improve all that much following Superstorm Sandy, and we continue to see problems with the three major hurricanes of 2017, starting with Hurricane Harvey. Due in part to the problems seen with the evacuations of Hurricane Rita, the Houston area was not evacuated and suffered massive flooding. Quite prominently on the news, there was a nursing home in Dickinson, Texas, where the water reached waist high, and 15 nursing home residents had to be emergently evacuated. Also with Hurricane Harvey, we saw that some disabled individuals had to take to social media to get help from lay rescuers. Furthermore, there was significant equipment loss and damage due to the flooding. There were also considerable disruptions in healthcare in the aftermath. 21 Texas hospitals had to either close or evacuate patients, and many clinics and community healthcare centers were closed as well. We here in Florida, of course, remember Hurricane Irma quite prominently. There were massive evacuation orders issued in advance of the storm, with nearly 7 million people evacuated. There were considerable gasoline shortages. Unfortunately, this left nothing left for the gasoline power generators, which some individuals rely upon to power medical equipment like CPAP machines. And of course, there was also a change in path from what was originally expected. So many who evacuated to the West Coast or Central Florida also found themselves without power. I give talks to the brain injury support group, and we had a young woman who was dependent on an electric power chair. And in advance of Hurricane Irma, her family evacuated her to a family member's home in Orlando, thinking that she would be dependent on electricity. But then they lost power there as well, and now she was in a less accessible home, still unable to power her devices, and she also faced considerable barriers getting back to the Miami area due to the massive traffic and gasoline shortages. So evacuation can sometimes come with some difficulties, particularly for people who are dependent on durable medical equipment and accessible home features. Also with Hurricane Irma, we of course had very prolonged power outages. At a time we had very high temperatures. Many will remember that the Rehabilitation Center at Hollywood Hills lost its cooling system and overheated. It unfortunately was not evacuated, and emergency services were not notified for several days until residents were already showing signs of serious distress. There were 12 deaths that occurred in the aftermath of this storm that were ruled homicide, including the youngest victim, who had a severe neurologic disorder that left her really unable to request help when she began to experience distress. Hurricane Maria made landfall in Puerto Rico and also struck the U.S. Virgin Islands in September of 2017. Following the storm, there were prolonged periods without access to basics like electricity, water, cell phone coverage, and the stores had a lot of difficulty reopening, so it was difficult to replenish supplies. The storm also displaced many thousands of individuals. There were serious disruptions in access to care, things like being unable to get medications and use respiratory equipment. Many of the island's hospitals were closed or not fully operational. By now, we know the official death count of 64 was highly inaccurate, but only 1 in about 10 deaths is believed due directly to the hurricane itself, with 1 in 3 due to delays in access to care and the aftermath. And last but not least, Hurricane Michael struck last year, causing considerable disruptions in access to care, both here in Florida and in Georgia. And among the casualties, 1 death was due to a gentleman being unable to access dialysis due to loss of power and transportation, with several other deaths chalked up to loss of power with the inability to use medical equipment. Next slide. So I wanted to switch over to discuss some of the risk factors for having difficulty during, after, and even before a major storm event. So those with mobility impairment may have difficulty preparing their home and obtaining supplies, may face barriers to evacuation, certainly need to consider the need for an accessible environment while they're displaced. They may face challenges navigating around debris and other obstacles. I apologize, my computer just went berserk. I will be with you in 1 second. And may face equipment damages and losses. Next slide, please. Those with impaired activities of daily living may have trouble accessing their caregivers or having their caregivers access them. Shelters may not have appropriately trained personnel or equipment. Individuals with spinal cord injuries may have all of the above, in addition to bladder and bowel needs that can be particularly difficult to meet in a shelter environment. They may also have difficulty regulating their temperature, so if there's a power outage and the AC is not working, they may face true medical crises. Next slide. Those with cognitive and or neurobehavioral impairments may have difficulty understanding emergency information, impaired planning and problem solving, may get overstimulated in a hectic shelter environment where there are a lot of people, perhaps a lot of noise. They may wander and may have poor safety awareness and judgment. The hearing impaired may have trouble obtaining emergency information, particularly through radio. They may have difficulty communicating their needs. Those with vision impairment may have difficulty obtaining emergency information via text message. They may have difficulty evacuating and have trouble navigating unfamiliar environment and debris. Those with medication needs may have trouble accessing their medications. Many pharmacies may be closed. This is particularly problematic if it's a medication from which someone can withdraw, such as benzodiazepines or baclofen. Those with needs for ongoing medical care may have trouble accessing health care, as clinics and hospitals may not be fully operational. Those who are dependent on technology may struggle, particularly if the power goes out. And lastly, residents in a nursing home have shown to be a risk factor for mortality and injuries during a storm. So what do we know about preparedness among individuals with disabilities? So there have been several large studies, including the Behavioral Risk Factor Surveillance System, which found that individuals with disabilities are significantly less likely than others to state they're prepared for an emergency, to have a 3-day supply of water, to have a working battery-operated flashlight, and to report that they would evacuate in the event of a mandatory evacuation announcement. And some of the reasons cited for not being willing to evacuate included lack of transportation and concerns about their safety and about their pets. The Health and Retirement Study looked at all adults ages 50 and older, and they found that there was worse overall preparedness associated with the increasing age, fair or poor self-reported health status, and greater levels of ADL limitations. Furthermore, they found that only fewer than 5% reported that their healthcare provider discussed emergency preparedness with them. So certainly there's a lot of potential for improvement there. Among individuals with spinal cord injury, wheelchair users were surveyed, and they found that many had evacuation plans from their home and from their workplace, but very few had evacuation plans if they had to leave their town. And among those who indicated having evacuation plans, they were often missing critical elements like transportation and consideration of necessary supplies. The families of children with special needs have also been surveyed, and parents were found to be underprepared for disaster, both by self-report and by recommended steps taken. Furthermore, the majority were unfamiliar with their local emergency resources. So there are some general recommendations available from the Red Cross and FEMA in this document, Preparing for Disaster for People with Disabilities and Other Special Needs. It's available free of charge at both of those websites. I do need to point out it was published back in 2004, which was prior to Hurricane Katrina, and we've certainly learned many lessons since with the major hurricanes that have come through since that time. But it does have some great recommendations, so I'll spend a few minutes reviewing what they are. So first, it does a good job encouraging the creation of a personal support network, which is having at least 3 people in each location one spends a lot of time. They encourage a comprehensive assessment of what one's needs would be before, after, and during a disaster. So thinking about things like personal care needs, equipment, electricity, transportation, errands, medications, animal care, and evacuation. I've highlighted electricity and evacuation, which I'll talk more about in just a moment, because it is important that those who require assistance with these things register in advance, and I have the links with which to do so in just a moment. Now, some patients and their families may struggle thinking about what their needs might be in the time of a disaster. And there's some helpful worksheets available, which have the links here to help walk them through the process step by step. These are the Ready Now Emergency Preparedness Toolkit for people with disabilities, available from Oregon Health and Sciences University, and the Emergency Evacuation Preparedness, a guide for people with disabilities and other activity limitations, from June Isaacson Kales. Next slide. So now is the perfect time to think about advanced registration for medically essential services through FPL. So if someone is dependent on electricity for either life or for function, it's important that they have priority turn-on service through the electric company. There's information available from FPL at this link here. And if someone wants to apply, they will require the physician certification that you all will need to sign off on, and that application is here. Furthermore, if someone may require some evacuation assistance from the county, that is available. They need to register for evacuation assistance in advance, and they can do so at the Miami-Dade government website. If someone may require medical assistance during an emergency through the county, there is a section for either a primary care physician or a home health nurse to help complete. The general framework for preparedness is really 4 steps. So first, get informed. 2, make a plan. 3, assemble a kit or a conglomerate of equipment. And 4, maintain your plan. I've also added here budget for emergency, as emergency preparedness and perhaps even displacement during a storm can get kind of expensive. So first, get informed. It's important that everyone knows what the risks and resources are in their area, including if they're in evacuation or flood zone. They need to know what assistance programs are available to them and register in advance if they need these, and should know what emergency shelter locations and types are in their area. Everyone needs to be familiar with their home health hazards and safest rooms. And it's important to stay up to date with emergency alerts to give oneself a running head start in the event that they need to prepare for a storm. So certainly paying attention to local news and government websites. And, these days there are so many free apps like the Weather Channel and Hurricanes app that can keep you up to date in the event of an approaching storm. Everyone needs to make a plan and a backup plan. And really, it's more than one plan, because people need to have a plan to escape their immediate area, as well as a bigger plan to evacuate their wider area or town in the event of a larger event. People need to have a plan for displacement if they're not able to access their home for some time. And it's important that everyone with pets also have a plan for their pets. Now, service animals are generally allowed at American Red Cross shelters, but pets are not. For lists of pet-friendly shelters, one can check out the American Kennel Club website, which usually will post these. But it's important that anyone who may require a medical shelter come up with a different plan for their pets. People need to think about how they'll evacuate via transportation. Using one's own vehicle is often best, but gasoline may not be readily available. Public transportation, unfortunately, is not always accessible. Transit options for the disabled are often best, but they are sometimes suspended once inclement weather approaches. People need to think about where they're going to go to ride out the storm. A friend or family member's home may not be accessible, and it's also important to consider whether that home is also in the storm's potential path. A hotel may offer some advantages in that they generally have generators. A short-term assisted living facility may also offer advantages in that they may have a generator and they're generally quite accessible to those with disabilities. And lastly, shelter is the resort, the last resort. Next slide. There are a number of different types of shelters, so one needs to think whether they'd be better served in a medical shelter versus a general shelter. General shelters are not always the most accessible environment. They may, for example, be in an elementary school with a toilet very low on the ground that may be hard for someone, perhaps with arthritis, to rise from. However, a medical shelter may not allow your pets to stay with you or your caregivers to stay with you. And if your caregiver can't stay with you, one needs to consider if there are caregiver services available. One needs to find out what sleep service might be available. So some shelters will provide cots, others may not. Lastly, if someone gets very overstimulated but could otherwise be accommodated in a general shelter, they may be able to bring a pop-up tent with them to reduce the stimulation and the noise and provide a little bit of privacy. For anyone who's dependent on a caregiver, they need to have backup plans. So they need to know their agency's contingency plan and have backup caregivers available. Those who are able to instruct someone new in their care should be ready to do so. And anyone who could not communicate what their needs might be should have pre-written instructions for backup caregivers and rescuers. People also need to have a plan for communication. They need to let people know they're safe or they need help. It's important to have a central point of contact with phone numbers written out. Facebook can sometimes be helpful. So you can mark yourself safe and let a lot of people know that you're okay, or to let them know you're not okay and that you need help. And the Zello app has been used, particularly during Hurricane Harvey, to communicate with lay rescuers and get some help. It's important that everyone have at least 3 days of supplies. That would include food, water, at least 1 gallon per person per day, any medications that they need, any health supplies they may need, like catheters, contact lenses, respiratory supplies, and any supplies needed for their pet or service animal. One should consider having more than 3 days supply when they reside in an area that's difficult to reach, if they're staying behind in an evacuated area, if there's a large-scale event expected, if they have dietary restrictions, if they're on essential medications, or if they're dependent on others for transportation. Everyone, of course, needs first aid supplies, a lot of toilet paper and hygiene items, waterproof matches, portable battery-powered radio, a whistle, maps, and cash. When the power goes out, everyone's going to want battery-operated or USB-powered fans. Important to have extra blankets, flashlights, and lanterns, lots of batteries or power banks. For those on medications that need to stay at a good temperature, a medication cooler, and generators can be extremely helpful. Gasoline-powered, for those who are going to use a gasoline-powered generator, it's important to have the gasoline in advance of a storm, as access to gasoline can be limited. And increasingly, people are using solar generators as well to help power some devices. Everyone should have regular bleach. It is both a disinfectant and a water treatment. To use it to disinfect medical equipment, one needs to use 9 parts water to 1 part bleach. And as a water treatment, you use 16 drops per gallon. And everyone needs cleanup supplies like garbage bags and paper towels. Anyone who walks slowly or who may fatigue easily or have difficulty walking under bad circumstances should consider having a travel or manual wheelchair for backup. Anyone who uses a chair should consider having a tire patch kit, as the debris can damage the tires of a wheelchair. Those with difficulty transferring should consider having a sliding board or portable lift with their emergency equipment. It's important to have headphones or activities to keep oneself occupied. And lastly, individuals who may have difficulty negotiating stairs, who may find themselves in a high-rise building for work, or maybe they live in a high-rise apartment, should consider having specialty evacuation equipment. Next slide. Such as an escape chair. So escape chair can be used with a one-person rescuer to quickly get someone down the stairs who may not be able to negotiate stairs on their own. There was a case of a gentleman who worked for the Port Authority who was a tetraplegic gentleman who was safely evacuated using an escape chair on 9/11. It's important that everyone maintain and practice their plans. They need to update them over time and replace used supplies. And in the days or hours before a storm, it's really extra important to stay informed, fill up your gas tanks, prepare your home, declutter. It's so easy to injure yourself when the lights go out over things that are on the floor. Do laundry and dishes while you still can, charge devices, fill water containers and freeze some of them. gather important documents, and if staying behind, it's important to pack a go bag with at least 3 days of supplies in case you need to leave emergently. Now I'm going to hand things over to my colleague Jair, who will cover the needs of patients on dialysis.
Thank you, Lauren. Patients on dialysis are a specific population that they share a lot of the recommendations and needs that the other patients with disabilities have, but I'm just going to point out a few specific points that they need to be aware and as well as their physicians. Something that is a common need, I think, for all the patients on disabilities is to get and wear a medical emblem. An emblem has very important information about the medical condition and the treatment that they may need in case of an emergency. And it tells the medical emblem, the medical staff about your special needs. It's important to know that the necklace, for example, may be missed if your upper body clothes are rolled up. So it's always better recommended to use a bracelet. And in patients on dialysis, it's better to use this not in the arm where is your dialysis access, because it can compromise the function of the fistula. If you need help in getting one of these medical emblems, you can ask your social worker that is available in every dialysis unit. And in some areas, some institutions like the National Kidney Foundation may have these medical emblems for free. And if you call the numbers like you're seeing in the slide, there are other sources of medical emblems like the Medical Alert Foundation, and but also you can get it very cheap from Amazon or your local pharmacy. So American emblem, it's something that we tend to not think about it, but I think it would be a very good thing to have in case of an emergency. Next slide, please. So we also recommend to prepare an emergency kit for patients on dialysis. And this is not different from patients with other medical needs. And this kit should have phone numbers from your doctors and dialysis units. And actually, every dialysis unit provides a list of these units. Also, it's important to have at least 3 days worth of medications and keep a list of medicines with the respective dosages in there. And it's important for the patients on dialysis to shop food for a 3-day emergency diet. And we're going to talk about a little bit about that. So what foods to buy? Patients on dialysis cannot eat freely as other patients can. And it's one of the most important things is patients on dialysis had to buy foods with low potassium content. And here you have a few examples that had low potassium. For example, green beans, apples, grapes, pineapple, corn, and a few others that you can see on the list. Low potassium foods is very critical in these patients because they may not be able to dialyze for 2, 3, 4, 5 days, and they cannot eat high potassium because high potassium can kill these patients. Some further tips, when you buy and store food, remember that you first have to use any fresh food items that you have available, then use what you have stored in your emergency kit. And if you have diabetes, limit your sugar intake. However, have candy available in case your blood sugar gets too low. And on a 3-day emergency diet, you will only be allowed 2 cups of fluid each day. In terms of drink, water is the best choice to drink. Dry or evaporated milk is okay. And you can also have cranberry, apple, or grape juice who have low potassium content, and no sport drinks or beverages that contain phosphate and potassium. In terms of what food to shop, here you have a list of the ones that are okay and the ones who you shouldn't be eating. For example, you can eat cereal, or you can buy cereal, mayonnaise, jelly. You can have low sodium asparagus, carrots, green beans, etc. But it's important for you not to buy bran, granola, or cereal with dry fruit or nuts, no heavy syrup. raisins or dry fruit, no dry beans such pinto, navy, black, ranch style of kidney, and no potatoes or tomatoes that have high potassium content. And as we mentioned, this is not, it's very important actually. More information about the 3-day emergency diet plan you can find in this website, the National Kidney Foundation, and some dialysis providers of the ESRD network. The links are provided, and these are additional useful websites to have more detailed information about the 3-day diet plan with specific recipes that you can follow. So now I'm going to hand over to Carlos for his part on this talk.
Thank you. Thank you so much. It is very important for us to remember how critical the role of the physicians is in the preparedness of our patients for emergencies. Remember, we have to identify which are the patients that are particularly vulnerable. And we are always thinking about those patients that are in wheelchairs, the patient that has severe mobility problems, but we have to think about some other patients that are vulnerable, that can have significant disability or impairment or affection of their health, but they are not as obvious as those with mobilities. For example, patients with epilepsy, patients with multiple sclerosis, even patients with migraines. They can have severe incapacitating and disabling migraines during these episodes on patients with conditions like myasthenia gravis. So we just have to keep an open mind and think that it is our job to recognize those patients, those that are particularly vulnerable. It is important, again, as it was stressed before, to have the water supplies and the medications, and to have a complete assessment of needs. Remember that there is a tremendous network and resources available provided by the state and the counties, but many times the patients are not aware of them, and many times physicians are not aware of it. I know, for example, Baptist Hospital has a very good program to assist patients, and so are other hospitals in the community. And I think you can be the liaison, the person who can connect the patients to those resources. And remember, not only that as physicians, we can identify those patients, but to tell them with examples what can happen if something goes wrong. And remember that we are authority figures, and that they believe us, and they probably will take an advice from a physician more seriously that from a social worker or just from a TV commercial. Next slide. So it is good to have a conversation with the patients about the disaster preparedness plans and educate them. Some patients are going to require special certificates for not only accommodations in the shelters in cases that patients with support animals, patients that require continuous electrical service, and they have to be prioritized by the utility companies. And there are some forms and registrations required by some counties and states that can provide them with help. Sometimes they will be prioritized during search and when services are provided. Some of the EMRs that we use have the ability to create like red flags with certain patients, and that would be very handy in the case of an emergency, just to get a list of those patients that are particularly vulnerable. Thank you. These are some of the helpful resources that can be accessed by the doctors that need to be far more familiar with the resources of the patients themselves, because we are the ones that probably are going to guide them and direct them to these sites. So I think this is the end of my participation, and thank you for participating in such a critical activity, which can make a big difference for our patients in the preparation for a disaster.
Terrific. Thank you all very much, Carlos and Jair and Lauren, for sharing your comments. I did want to point out that we have loaded most of this material on our website for the DCMA. So we would encourage anybody interested in this information or to find out more, follow any of the links that have been provided today, to visit our website, and under the Hurricane Preparedness tab, there's a series of these materials that were highlighted throughout tonight's presentation. I would also encourage you, as you review these materials, our email address is on the bottom of this page, where you can email the DCMA directly if you have any questions or want any additional follow-up from any of today's presenters. That email address at the very bottom of this page, sorry to make you dizzy, is dcma@miamimed.com. So again, that's highlighted for you there. I did want to thank again our speakers for tonight, and maybe give you all one more opportunity to mention anything that you didn't get a chance to address during your presentation, or any final thoughts for the audience before we conclude. If not, again, thank you to all of you for your presentation tonight, and thank you to our members for paying attention as we enter hurricane season this year. And again, we are here to be a resource. If we can provide any background information for you, we're happy to do so. Please don't hesitate to reach out. And with that, we can end tonight's webinar. Thank you very much for your participation.